Pooja Thukral and I work with Cloudnine group of hospitals, Faridabad. Today I will be talking about emergency contraception. Now I thought of talking about this topic because recently I had a patient who came to me and they were just discussing that they've been using emergency contraception as a regular contraceptive method. Now this has been there in the market for very long. So I thought that there's still awareness about how to use the emergency contraceptive pills isn't much. So I decided to speak about this topic. So basically, what is emergency contraception? It is also called as the morning after pill. It's also commonly known as the I pill. So what is it basically? And what are the situations when we need to use the EC or the emergency contraception? Now the emergency contraception, as the name suggests, it's used in an emergency. Now the emergency can be if there is a failed contraception, failed as in if the condom breaks, or you've been taking your regular oral contraceptives and you've forgotten to take your pill, and if you've had an unprotected intercourse, so that's an emergency. So either you've not used your pill, or there's a breakage of the condom, or if there's a non-consensual sexual activity and the lady doesn't want to continue or take the risk of having a pregnancy. These are the situations when the emergency contraception is used. Now the emergency contraception can either be pill or it can be an intrauterine contraceptive device. Now the most popular emergency contraceptive pill, you all know it's like available by the name of an I pill. You can go to the chemist, it's available over the counter. Now the emergency contraceptive pill should be taken as soon as there has been an unprotected sexual activity. So there is a time margin, like for the levonorgestrel or the progesterone only pills, the time it should be taken is within 72 hours of unprotected sexual intercourse. Nowadays we have a newer hormonal contraceptive which is known as ulipristal that can be taken up to 5 days from the unprotected sexual act. So these are the medicines or the medications which are available as emergency contraception. Now though the name says it's morning after pill, but the best way to use the pill is as soon as possible. Even though you have a window of say 72 hours or up to 120 hours, but the sooner you take it, it's extremely effective. The effectiveness is said to be around 98% if it is taken as soon as possible. And so this is the pills which is available as an emergency contraception. Now we also have intrauterine contraceptive devices also available. So we have our traditional copper T, and we also have the hormonal containing intrauterine device which is known as the levonorgestrel. Now what has proven to be efficacious and what has been widely used is the copper containing IUCD. So what is the advantage of a copper containing IUCD or a IUCD over a contraceptive pill? The advantage is that it can be used up to even 5 days of unprotected sexual intercourse. Like I said, the I pill can only be taken up to 72 hours. You can take it beyond 72 hours, but it's not going to be as effective. But the copper T can be inserted up to 5 days of unprotected sexual intercourse, and also you can continue to use it as your regular contraceptive. So the life of a copper T can be 3 years, 5 years, and even 10 years. So that's the advantage of getting an intrauterine contraceptive device inserted. But the disadvantage is you'll have to go to the doctor and get the IUCD inserted. However, a pill you can just pop it, buy it from a chemist, and you can take it as soon as you realize that there has been unprotected sexual activity. Now the next question which comes to the mind is that does it have any side effects? So like hormone has side effect of having nausea, you may feel vomitish, you may have headache and dizziness. These are the only side effects that you experience after taking an emergency contraceptive pill. And with the contraceptive device, when you get it inserted, there's temporary discomfort for 5 to 10 minutes, and subsequently you may have spotting for a few days. So these are the side effects of emergency contraceptive pill. Now how do you know whether it has worked or not? So after taking an emergency contraceptive pill, if you get your regular period, the time when you should get it, you know that it has worked and there is no pregnancy. However, if your periods are delayed, suppose you're supposed to get your period on a particular date and they do not come even beyond like a week after your expected menstrual date, then you must check for a urine pregnancy test. Then there is a possibility that the emergency contraceptive pill has not worked. Now having said that, it is very important that at what time during the menstrual cycle did you take the emergency contraceptive pill. How does the emergency contraceptive pill work is that it delays ovulation. Ovulation means when the egg is released in the body. So if we say that it's a lady has a regular 28 and 30 day cycle, so we know that the ovulation is going to happen during the 14th or the 15th day. So how does the pill work is that it delays ovulation. So if it is taken in the first part of the cycle when the ovulation hasn't happened, or the pill may work and delay the ovulation, that is the time that the morning after pill or the emergency contraceptive pill will be efficacious. If, however, the ovulation has happened, or if the intercourse happens in the latter part of the cycle and the ovulation has already happened, or when the egg and the sperm have met and the fertilization has already happened, then the emergency contraceptive pill is not going to work. So what does it do? It is going to delay ovulation, but it's not an abortifacient, meaning that if there is already a pregnancy which has been already established because of a result of unprotected sexual intercourse, the abortion is not going to happen because of this morning after pill. Then there are different medicines which are given when a lady or the couple doesn't want to continue with the pregnancy. Then how many times can I take pill in one cycle? So it's not recommended to keep taking the emergency contraceptive pill multiple times in one cycle. As the name suggests, it's an emergency contraception, which means that once in 6 months you can have an emergency, once in 2 months you can have an emergency. But you can't keep taking the pill as a regular contraceptive. If you've had the need to take an emergency contraception, I would advise go and talk to your doctor and discuss about a regular contraceptive method, which can be a condom, which can be oral contraceptive pills, which can be injectable contraceptives which are taken every 3 months, which can be intrauterine contraceptive device. We have hormonal vaginal rings available, and of course we have the permanent sterilization method which is available. So this is about the morning after pill. Now in case you've taken the morning after pill and you get pregnant, now the study says there's no need to abort the pregnancy because this medicine is found to be effective. Effective as in it's safe, it does not cause any harm to the pregnancy if a pregnancy has happened after you've taken the emergency contraceptive pill. And if there is any doubt, whether I should be taking the pill, I'm on multiple other medications, then you must go and discuss with your doctor that I've been on these medications, then can I take this medicine? In majority of the conditions, you can take this tablet. It does not have any drug-to-drug interaction. Even for women in which the regular oral contraceptives are contraindicated, like ladies who have problems with thrombus forming in the legs, have thromboembolism, even those ladies can take this hormone because it's just a single dose of levonorgestrel. So a lot of women who may not be able to take the regular oral contraceptive pills, they can take this emergency contraception. But if you feel there is any doubt, it's always good to go and talk to your doctor. And one thing which I want to emphasize is that it's not a regular contraception. You can use it like once in 6 months. If you feel the need to have a regular contraception, you don't want a pregnancy, then it's always advisable and go and talk to you about that. It's, there's so many options available which you can use as a contraception, and you can avoid an unintended pregnancy. And so this was about the emergency contraception. The tablets are also not very expensive. They are available over the counter, and it can be taken, again just to reiterate, it can be taken up to 72 hours. The regular oral contraceptive, the regular emergency pill which was available earlier, which was known as the levonorgestrel, it's also known as the pill, to be taken within 72 hours of unprotected intercourse. Nowadays we have ulipristal 30 mg, that can be taken up to 5 days of unprotected intercourse. Copper T can be again inserted up to 5 days. So it's my request that not to use the morning after pill or the emergency contraceptive pill as a regular contraception. Thank you.